This is Kimberly Alexander.
And is Dr. DeGennaro also?
I'm here as well, yes. Hello, Dr. Goodwin.
How both of you?
Great, how are you?
Okay, well, we're going to talk today about the focus of the Leukemia and Lymphoma Society as it relates to Blood Cancer Awareness Month.
That's right.
Okay. And Dr. DeGennaro, you're president of the Leukemia and Lymphoma Society?
Yes, I am.
And Kimberly, you lost your husband, I understand, to blood cancer?
Right, absolutely right. I lost him to multiple myeloma.
To multiple myeloma, okay. How long ago was that?
He passed away in 2010, so it's been about 7 years.
Right, well, we're certainly sorry about that.
Thank you.
And I guess you have become actively involved in multiple myeloma since then?
Well, I've become active with raising awareness about different blood cancers and helping other cancer patients and caregivers as they navigate through the diagnosis.
Okay. Well, that's very good that you've done that.
Thank you.
Dr. DeGennaro,
Yes.
what are blood cancers and how are they different from other cancers?
Well, blood cancers, the primary forms are leukemia, lymphoma, and multiple myeloma. As you probably know, there are many different forms of these diseases, but those are the primary forms. These are cancers. We need to be certain that your viewers know this. These are cancers, and they need to be treated like cancer. One of the biggest challenges we have in diagnosing the blood cancers is that we do not have a mechanism for early detection. We don't have a mammogram for leukemia or a PSA test for multiple myeloma. And as a consequence, patients, because the symptoms can often be very vague, patients ignore them, and finally, when they finally do come to their physician and are diagnosed, they have a fairly advanced form of the disease and need to be treated very, very rapidly.
And the treatment can be very challenging, I'm sure.
Well, it can for some forms of the blood cancers. We're still using traditional chemotherapy to treat diseases like acute myeloid leukemia. But on the other hand, we've made rapid progress, and for a different kind of myeloid leukemia, chronic myeloid leukemia, this disease was a death sentence as early as recently as the year 2000, where the life expectancy was 3 years. Today, a newly diagnosed CML patient doesn't get a death sentence, they get a prescription. They get a prescription for a drug, and they treat themselves at home with 2 pills a day and frequently live long and healthy lives. So it's really a bit disease dependent, but we've made tremendous progress in treating the blood cancers. Still more work to do, though.
Yes, okay, but that's still good news. Why is Blood Cancer Awareness Month so important? And tell us a little about the Leukemia and Lymphoma Society.
Yes, well, I think when you hear the statistics, you'll understand why Blood Cancer Awareness Month is so important. There's a new patient diagnosed with a blood cancer every 3 minutes. And someone passes, unfortunately, from a blood cancer every 9 minutes. Taken together as a collection of diseases, leukemia, lymphoma, multiple myeloma, the blood cancers are the 3rd largest cancer killer in the United States today. So we think it's vitally important for Americans to know about the blood cancers and to know where to go and get help should they or a family member become diagnosed with one of these diseases. The Leukemia and Lymphoma Society, we're dedicated to putting an end to these diseases. We have funded over $1 billion in research leading to the treatment advances that we've had so far. We're committed, our vision is a world without blood cancers. We're committed to finding a cure and hopefully someday in learning how to prevent these diseases. I'm really pleased to be here with Kimberly because one of the diseases that is high on our radar screen, multiple myeloma, as you may know, Dr. Goodwin, occurs more frequently in the African American population. Yeah. And we want to be certain that we get the word out to that population so that they know better about this disease and are seeking treatment, are seeking the best resources that they can possibly have should they ever be diagnosed.
Okay, that's also extremely important. Kimberly, tell us about your experience as a caregiver and how you got involved with the Leukemia and Lymphoma Society.
Well, I became a caregiver at 32 years old. I didn't even know what being a caregiver meant. I just looked at it like my husband is sick. I'm supposed to find out everything I can to help him get better. And so to me, that meant, questioning the doctor. I probably harassed his doctor way more than he wished I did. But you know what? I thought it was very important to find out as much as I could about not only the disease, but the side effects, the symptoms, everything that happened, the different treatment options. It was really a difficult road to go down. It was difficult to balance being a caregiver and being a wife and being a mom. And I ended up relying on my support system quite often just to kind of help me get through it. And so to me, knowing that there are resources out there like the Leukemia and Lymphoma Society, it's very important to share my story and let people know about the different resources so that they know that they're not alone. There have been so many advancements also that have been made since Elijah was diagnosed in '05, and I think it's important for caregivers and patients to have that information as well and know that there is a light at the end of the tunnel. If you just kind of keep pushing through, you can get through it with amazing help. You just have to know where it is.
And so what would you say to a person who has someone in the family with multiple myeloma?
Anybody dealing with multiple myeloma or leukemia or lymphoma, I would encourage them to visit the LLS website at lls.org to get information.
Let's hold on so everybody gets it.
Okay.
What's the website?
It's lls.org.
lls.org.
Right. So if they visit that website, there's all kinds of information there. There are physicians and nurses that are available to provide all kinds of answers that they may have. And it's really important to take advantage of those resources.
Okay. And how can people get involved if they want to get involved in the fight against myeloma?
Well, they can also visit the website for that information as well. LLS is responsible for having several campaigns that raise money for blood cancer research, and those dollars help find cures. And so that is why I'm so involved. And I always encourage people to get involved and help raise money, because at the end of the day, finding a cure for myeloma, finding a cure for leukemia and lymphoma is very, very important. And so if you visit the website, that information about the different campaigns is there as well.
And Dr. DeGennaro, what would you say would be the thing to do to help patients who have one of the lymphomas or myeloma?
Yes, I think it's very important that if you receive a blood cancer diagnosis, leukemia, lymphoma, multiple myeloma, that you seek a second opinion from a physician who is an expert in treating the form of blood cancer that you have. These are relatively rare diseases. As Kimberly mentioned, the treatment options have changed dramatically over the last few years. And so getting a physician who is up to date and is focused on your type of blood cancer is absolutely key to successful treatment.
Okay. So let me thank both of you for sharing this information with our audience. I'm sure it's helpful, and especially since it's more prevalent in the African American community, which is a community that we focus on to a significant extent. You did not mention the Hispanic community. Is it very different with them?
There's not an increase in the occurrence of multiple myeloma in the Hispanic population. The one difference we see there is that Hispanic children have a slightly higher frequency of leukemia than the African American or the Caucasian population. So they do need to be informed about this just as much as anyone else.
Okay, let me thank both of you. It was very helpful information that you've been providing to the Health Power community, and I'm sure they will benefit from it.
You're very
Thank
welcome.
you.
Okay, have a good day.
You too.
Good day.